Okay.
Okay, thanks.
Welcome, everyone. We'll just wait a couple minutes to get started to let people join, and then we'll do introductions. Okay, good morning, everyone. It's 10 o'clock, so I'm going to get started just because we have a full agenda and want to make sure we have time to get to everything and also have some discussion. So I am Colleen Kapsamalis. I'm at the Violence and Injury Prevention Mental Health Promotion Branch here at the Colorado Department of Public Health and Environment. And as you probably saw from some of my email communications, I have taken over with facilitating the Plains to Peaks Regional Network, which is the regional network or coordinating organization for regions 7 and 8 for CDC's core state violence and injury prevention program grant. So for those of you who are new to the web-based learning opportunity, welcome. Hopefully you were able to log into Zoom okay, or at least on the phone line. And if you have any technical difficulties or have trouble hearing or anything like that, please feel free to type in the chat box. Marissa Mora from the Colorado School of Public Health is going to be helping with some of the coordination and tech aspects of Zoom. So thank you, Marissa, for helping with that.
Sure.
Okay. So just to get started and just so that we can hear everybody who's on the call, it would be great if folks could introduce yourself and your role within your organization. And then it would be great to hear one thing related to the work that you do in injury and violence prevention that you're excited about for 2018. And I think that the easiest way, just so that people aren't talking on top of each other, is I'm going to go through and go through who's currently on the Zoom screens and call out your name, and then if you could introduce yourself and your role and something you're excited about. I think that would be the easiest way, just so that we don't talk on top of each other. So I'm just going to go down the list based on what I see on my screen, and Carol Runyon, you're up first after me. And you're on mute right now, so make sure you unmute yourself. Yeah, there you
go. I'm Carol Runyon. I'm at the Colorado School of Public Health and work with CDPHE on this regional initiative.
And anything you're excited to related to your work in injury and violence prevention for 2018?
Well, we're working a lot on the issues of suicide prevention in Colorado, and also on child maltreatment and trying to encourage more health department focus on child maltreatment.
Great, thank you. And then Marissa, it looks like I have you up next.
This is going to sound a little redundant, but I'm a graduate student at the Colorado School of Public Health, also working with Carol on child abuse and maltreatment. And so I think I'm just excited to work more closely with the Colorado State Health Department because that's an area I haven't really touched yet.
Great, thanks. And Sarah Spafford, hopefully I'm pronouncing your name right.
You did. You're good. So I am the Intentional Injury Prevention Coordinator over at the Wyoming Department of Health. I started here only a few months ago, so I'm excited to get started moving on implementing some programs and seeing what we can do.
Okay. Thanks, Sarah. And Tiffany Conroy, I saw your name.
Yep. Hi, this is Tiffany. I'm the Violence Prevention Coordinator at the Iowa Department of Public Health. And one thing I am looking forward to is I'm going to be kind of reinvigorating our evaluation subcommittee of our Domestic and Sexual Violence Prevention Advisory Committee here to start really looking at and doing a deep dive of what our evaluation capacity is and what our data and everything is here in Iowa for our sexual violence prevention work.
Cool, thank you. And I see Dwayne's name.
Hey, Dwayne Smith, Injury Prevention Program Manager at Children's Hospital of Colorado in Aurora, Colorado. One thing I'm excited about working on in the coming year is tying some financial metrics to preventable injuries using our hospital trauma registry data, emergency department utilization data, and our billing data, to link those up to try to put some dollars and cents on our institutional cost for injuries that go unprevented.
Great, thank you. Thanks for sharing. Benny, would you mind introducing yourself?
Hi, Benny Hugh, Iowa Department of Public Health Injury and Violence Prevention Program Coordinator. You know, I'm going to retire at the end of December from my position, so I guess when I think about something I'm excited about is kind of figuring out what the heck I'm going to do with my time and where I'm going to focus my energy. So it'll probably be the area of injury and violence prevention, but I'm not sure to what extent. So that's about it.
Well, congratulations on your upcoming retirement. We'll miss you as part of this network, and feel free to call into our learning opportunities if you have some spare time in your retirement.
I'll still be involved in safety compliance.
Okay,
Sure.
okay, great. So we may be interacting with you anyway. Great.
Oh, yeah.
Let's see, who else? Susanna, would you mind introducing yourself and sharing?
Yeah, my name is Susanna Bird. I work with the Utah Division of Substance Abuse and Mental Health. And one of my hopes is that as we move forward, that we continue to collaborate with our Department of Health, who is more focused on injury and violence. We look at a different metrics, essentially, but I also am excited to look at how our risk and protective factors line up with both mental health and substance use injuries.
Okay, thank you. Let's see. I lost my mouse. I think I saw, let's see, Lindsay, could you introduce yourself?
Hi, everyone. This is Lindsay Myers. I'm the branch chief for the Violence and Injury Prevention Mental Health Promotion branch in Colorado at the State Health Department. And I'm excited about lots of our work. We have been using the, kind of the frame of shared risk and protective factors for a long time, particularly with violence prevention. And one of the things that we have kind of a unique opportunity to do right now is to use that frame to try to engage chronic disease partners and maternal and child health partners and WIC, et cetera, within our department, in our division, and are trying to experiment with developing a pilot project that we can implement across the entire division using the concept of shared risks and protective factors that our branch has been working on for so long. So I'm really excited to kind of broaden our shared risk and protective factor efforts.
Thank you. And Lisa, could you introduce yourself?
Hi, I'm Lisa Roth, and I'm with the University of Iowa Injury Prevention Research Center. I'm the Deputy Director here at the center, and I think one of the things we're excited about coming up in 2018, and maybe excited is a little bit too ambitious of a term, but we have to reapply for 5 years of funding. And so we get to rethink what our kind of work trajectory and our research trajectory will be, but also what our outreach plans are going to be as well for the center. And one of the opportunities for us is actually to work with this regional network. So we're excited about that. Thanks.
Thanks, Lisa. And then Mandy, could you introduce yourself and who you are and what you're excited about in 2018?
Hi, everybody. Mandy Slegg with the North Dakota Department of Health. I'm the Injury Prevention Program Director, and I'm excited to expand and grow our Impact Teen Drivers program, which we just started in the fall of 16.
Thanks. And then I have Sarah. Could you introduce yourself?
This is Sarah Earhart-Reed. I'm the Sexual Violence Program Coordinator with the Office of Women's Health at the Missouri Department of Health and Senior Services. And I think in 2018, I'm excited to keep working. We work primarily in Missouri with our college campuses, and we are working on helping our universities and colleges to integrate violence prevention into their campus. So I'm excited to keep doing that work.
Thanks for sharing. Sherry?
Hi there, this is Sherry Sage, and I'm the State Director for Safe Kids Kansas. Our lead agency is the Kansas Department of Health and Environment, so I work with Lori Haskett in our injury prevention section, and we're excited to continue the work that we're doing in poison prevention, particularly our role with over-the-counter and prescription medication safety, and also safe sleep priorities.
Great, thank you. And then Lori, another rep from Kansas.
Hi, this is Lori Haskett, Director of the Injury and Violence Prevention Program at the Kansas Department of Health and Environment. And I think I'm most excited about expanding our work with the Maternal Child Health Program and local health departments.
Thanks. And then I'm not sure who this is, but the name that's showing up on my screen is SIMOPI. I don't know, or P1.
Hi, this is Pat Simmons, and I apologize, I didn't know how it was going to show up, but anyways, I am the Bureau Chief with Community Health and Wellness at the Missouri Department of Health and Senior Services, and that's the bureau where our injury prevention program sits. And I guess I would say we just finished a strategic planning process with our Injury Prevention Advisory Council, so I'm excited to see that finally finished and take the next steps for implementation.
Great, thank you. And then there are a lot of, there's also a lot of numbers, like people's phone numbers. So if you haven't introduced yourself, this would be a great opportunity. I know, Jamie, I saw that you typed into the chat box. So if you could introduce yourself as well, that would be great. Anybody that I missed.
Hi, this is Jamie Mills. I'm over at the CDC. I am the project officer for this region and for Colorado, and I'm actually super excited about the number of you that signed in today. I didn't expect to have this many different stakeholders that are working on violence and injury prevention. So I'm actually super excited about this program and connecting, especially our funded and unfunded partners, and pushing the envelope and developing some new strategies that for the region. So this has actually been super exciting to see that all of you all have decided to join us in this work.
Thanks. Was there anybody else that didn't get a chance to introduce themselves? Jenna Jones is here as well. She just joined the chat. So I don't know if you want to say who you are, Jenna.
Sure. Hi, this is Jenna Jones. I'm an injury and fatality prevention coordinator with the State of Colorado Department of Health, and I focus on motor vehicle strategies, and I'm excited for next year to look at applying the shared risk and protective factor framework to motor vehicle work, how we can expand our processes to more of an environmental approach, how we can connect it to other types of work, kind of unsiloing the work and look at it from the bigger picture instead of just as individual behaviors.
Great, thank you. All right, anybody else? Last chance to speak up. Okay.
This is Jamin Johnson. I'm with the Wyoming Department of Health. I'm the unintentional injury prevention coordinator. And I'm excited because we're just wrapping up a updated needs assessment, and we're a brand new team. All of us are pretty new, so we're all pretty excited to figure out what things are going to look like when our needs assessment is complete.
Great, thank you. Anyone else? Okay, well, it's really great to hear everybody's voice. Thanks so much for joining this morning, Monday after Thanksgiving weekend. And I also really appreciate you sharing what you're excited to work on related to injury and violence prevention in the next year. And hopefully, as we meet for our learning opportunities on a monthly basis, we can hear updates on progress towards what you're working on, and maybe think of opportunities to do some peer learning and sharing across our region so that we can learn from each other as well. So for today, I did just want to start because, as I said, I've taken over coordination and facilitation of our RNCO for our regions, and just wanted to check in on kind of where we're at and talk about Plains to Peaks Regional Network and our revamp. And so some of this, I apologize if it's a bit redundant, but I did think it would be a good opportunity, since we do have some new members since our in-person meeting at Safe States Alliance, to just remind folks of the purpose and talk a little bit about what the structure is going to look like going forward. So as most of you know, the purpose of our regional network is to coordinate peer-to-peer knowledge sharing and learning for our state injury prevention workforce and key partners. So not just limiting to state injury and violence prevention directors, but also to other partners across our states that do work across common goals and shared outcomes. We are going to be doing this through the provision of learning opportunities that are aimed at advancing violence and injury prevention best practices and program implementation, and then also taking the opportunity to share scientific evidence and programmatic best practices related to violence and injury prevention across our various topic areas that we all work on. The structure, we will plan to have monthly web-based learning opportunities. And if you remember, I sent out a doodle poll a couple months ago to figure out when the best times during the week would be to have these learning opportunities. Previously, those were on Friday mornings, and I think that conflicted with people's schedules, including my own, to coordinate those. So, so based on the doodle poll that I sent out, the most popular times for us to meet were on Monday mornings, Monday afternoons, and Wednesday afternoons. So my plan is to schedule these monthly learning opportunities and alternate across these 3 days and times. And hopefully by alternating those of us who can't make a certain time or have a standing conflict, we're able to make on those months that they are more available. For standing agenda items for the learning opportunities, I met with the advisory team not too long ago, which I'll talk about that team in a minute. But we had, originally these were scheduled for an hour and a half, and we had talked as a team that an hour and a half might be kind of hard in a web-based setting, especially to make sure that we're engaged for the full time during our learning opportunities. So we decided to cut those back to an hour, which is why we're meeting an hour today, and we'll be going forward. And the standing agenda items will be for the opportunity for us to introduce ourselves and share any state updates or highlights or upcoming activities. And then to have more formal presentations either by the Plains to Peaks members, you know, as part of our VEST membership, or other experts in the field, depending on the specific competency, skill area, or topic area that we'll be focusing on for that particular learning opportunity. So to keep those presentations kind of brief, maybe 15 to 20 minutes, 30 minutes at the most, and then really having an opportunity for discussion and peer learning on that same competency or topic area so that we can get a little bit more in depth in our peer learning. There, we had also talked about reaching out to members in advance for the opportunity to share the work that they're doing on a specific skill or competency area or topic area. So, so just know that I'll be keeping track of what you've been working on, and appreciate you sharing what's upcoming in 2018, because I think that that's a really good avenue for me to learn about what you're doing in your particular states and in your topic areas, and then we can access each other for peer learning. And then the web-based platform that we'll be using is Zoom, like today. And so what I really like about Zoom is that we can record these opportunities if you miss one, and we'll post those to our website. And then there's also some functionality around chat boxes and doing some polling that we're going to play around with later. And what I really like about it is that if you have a webcam, we can see each other, and it makes it feel a little bit like we're in person rather than across different time zones and just on the phone. So hopefully everything goes seamless with Zoom. Please let us know if you have any technical difficulties, and we'll try and troubleshoot those. And then, as I mentioned, there is an advisory team that has been meeting. The purpose of this Plains to Peaks advisory team is to provide guidance on the monthly learning opportunity agendas, and then other general feedback on the coordination of the regional network coordinating organization. So our plan is to meet bi-monthly, so every other month. And right now, the current membership includes 6 members representing both research and practice. And this is kind of a call out to Wyoming if you're interested in joining. DL was a previous member, and when she moved on from her role in Wyoming, it opened up a spot on our team, and so it would be really great to have someone either from Wyoming or from another state level practice representation, since we have probably about half and half research and practice and have room for one more. The other option that we talked about was inviting a different member every other month, and so that we can keep the membership fresh and keep different perspectives coming to those team meetings. So if you are interested in joining the advisory team, please write me an email, and I can invite you to the next meeting or have a offline conversation with you to talk a little bit about what the commitment is and what the role might look like. But we do want to make sure that the Plains to Peaks Regional Network is useful to our membership, and so part of that is making sure that we have the appropriate representation on the advisory team as well. And then for methods of communication, as you've seen, I will be the main point of contact and will be emailing out our list for any meeting reminders or sharing of information. We have a list of about 65 members now, which is really cool. And so I keep that contact list as up to date as possible. If you ever forward my emails along to anybody, or you think of anybody else that you want me to add to the list, or you want to check to see if they're already on our membership list, I'm happy to verify that or to add anyone new to the list, since we are always recruiting and building the membership of this regional network. The other place to get information is our Plains to Peaks collaboration website. I'm going to see if I can easily share this website with you all right now. Okay, I guess that's not going to work real easily, so.
It works.
Oh, can you see the website?
Yeah.
Oh, okay. I am just seeing the same the slide. So okay, so if everybody sees the website, that's good. Like I said, I'm working on like different screens here, so it's a little hard to see what everybody else sees. So this is our collaboration website. I had sent out reminders to sign up and follow by email. So here on the right sidebar, if you enter your email box and click submit, I think that there is a authenticator for that. So you should get an email to you to make sure that you actually signed up for that. And then every time we update it, since it's operating under Google Blogger, every time we post a new blog, you'll get an email notice with that information. I'm happy to share any information on this blog. So if there's anything that is happening locally for you that you're just trying to get more information out to different partners around any materials that you develop or trainings that you have upcoming or resources, please let me know, and I'm happy to post a blog. It takes about 3 or 4 minutes for me to do it, so it's no problem at all for me to do that. And then also on this website, there's a brief about me page with information about who we are. There's this member list to be added soon, and Lisa and I will talk a little bit more about what that will look like as a result of our inventory member survey that we sent out. But we do want to make sure that we are able to access each other as resources. And so with that, if people are comfortable with it, we would like to share who are members on the team or on the regional network, as well as contact information. We also have our previously recorded learning opportunities on here, and a link to a Google folder that has all of the prior agendas as well as slide sets. So if you miss a learning opportunity, or you want to re-listen again because you heard something that someone said and want to learn a little bit more about it, or you want to share with any of your other partners, this will be up to date after every learning opportunity. And then there's a page for state highlights, which is empty right now, but I would love to be able to include any highlights and successes for each of our states as they come up. So if there's anything exciting that's upcoming, or you want, or we could even link to, if you have a particular website that you use in your states or with your organizations, it would be nice to link to those pages from here. And then likewise, this is something that we're still building out, but wanting to share some data resources on our webpage. So both national data resources as well as any state-specific resources. So if there's any state-specific data websites or fact sheets that you have, this could be a good place to share that with the rest of the members of our region. And then likewise with any resources, we'll be building out the site as we get them. So if there's anything that you've developed that you want to share with the rest of the region, I think this would be a good place to share them. I think as an example, and something I need to get from the Iowa ICRC is the policy briefs that, or I need to post them, I have them, but the policy briefs that they've created and have presented to our team in the past, so that those can be a resource to be used by members of our region. And then you'll see here that if you are in need of any more customized or specific technical assistance, you can reach out to me. My email address is listed here, and then I can connect you with the appropriate person or resource with the expertise in that area to provide you with that specific technical assistance. And then I just want to go back to the slide set, but are there any questions that anybody has based on the information I just shared? Okay. Well, then we'll move on to our next agenda item, and Lisa Roth at the Iowa ICRC is going to help present on our results from our member inventory survey that we just sent out a couple weeks ago. So a big thank you to Lisa for your help with developing that survey and disseminating it and sharing the results. And just let me know when you want me to change slides. I'm happy to do that.
Great. Well, no, it was a great opportunity for us to collaborate with this RNCO, simply because I think the information that Colleen and I wanted, or we hope to collect, is going to be useful to everybody in the region. And so we know that it was a pretty short time frame that we asked you to respond in, and Colleen will talk about this probably towards the end, but we do hope to leave that member survey open indefinitely, just as people, maybe come into the region as new members, they can continue to fill that survey out. But really, our purpose was to collect some updated contact information and some basic demographics from everybody participating, and then really help us prioritize some of our activities, develop our learning opportunities, and then really think through, how we can provide technical assistance and what those needs are.
Sorry, hold on one second.
That's okay.
I was just informed that the...
Oh, were you showing like in
it's
presentation mode?
Yeah, so I'm just trying to, let's see if I can.
Sure.
Does that look better?
Yeah, that looks good.
Okay, it doesn't have the presenter mode.
Yeah, looks good.
Okay.
So I was actually, you can go ahead and flip to the next slide. I was really pleasantly surprised with the short time frame that we gave you, how many people actually did respond. So we had 32 members who completed the survey, and we had a majority of them were for the practice community, but that's not a surprise based on, the membership of this region. But there were 7 with the primary role of research, which is exciting to see because we like to see that bridge between research and practice. And actually every single state in the region, all 10 states, had at least one person respond. And so all states were represented as we look at these survey results. You can go forward. So I know this is a lot on a slide, but this really, and what we're going to do today is take these and give you just a really kind of overview of some of the questions and what we found. What we are planning to do is put together a much more extensive report that will generate. Our epidemiologist is doing some frequencies and looking at some other things, and we'll generate as a report in a PDF format and send that out so you can see more specifically numbers of respondents, things like that. But what I want this to illustrate is just that we have a region who has a lot of expertise for certain in all of the different injury and violence topic areas. And in that other category, I was going to just bring up, because there was a lot of fill-in or open-endedness to that question, and I was going to try to pull that up, and it really ranged from substance abuse and mental health issues and illness prevention to safe sleep, head and neck injuries, farm injuries, and some people just had oversight in all of these areas, but maybe not direct expertise in an area. And then we had some direct patient care and physical therapy background as well. So truly, this is just to see that, hey, we have a lot of expertise in a lot of different areas running throughout our region. Hang on. What we tried to do, as Colleen and I were collaborating on putting together this survey or this inventory, was take a look and include the kind of the skills competency areas from the Safe States model here. And again, this was the question that just asked you to weigh in on the core competencies and then your level of expertise in that area. And again, I feel like as a region, we are fairly knowledgeable in all the different core competency areas, and then proficient that you're very comfortable. And some of you gratefully have said that you would be willing to provide your expertise or your education and lead some of our peer learning opportunities based on your knowledge and expertise in these competency areas. So again, this is more of just an illustration. And I know in a PowerPoint slide, it's a little bit hard to tease out some of these specifics, but a lot of knowledge here. Colleen, I don't know whether you had anything to add in that area or not.
No, I don't think so. I mean, I think you know, as we develop and do a little bit more in-depth analysis and understand who said that they would be willing to be a facilitator, and really understanding who checked off that they were proficient in an area, it'll be really helpful, I think, for us as a region to map some of that out.
Agreed.
So I guess to that's a good segue, is that Lisa and I had talked about, and I think as an advisory team as well, talked about posting a list of the members along with the levels of ability in competency and skill areas, and I'm thinking more around the knowledgeable or proficient levels in an area, like assigned to a particular person's name and contact information, and we were just wondering if this, or how this information would be helpful to your work in your state.
Oh, this is Vinny. Can you guys hear me?
Yes.
I want to make sure I got off mute. One thing that comes to mind is like in areas where our state might be low on knowledge or experience, and I'm trying to think of it as ATV, you know, rollovers or whatever, I could see a benefit to knowing who else to call in the region for some information. But I'm also thinking that there might be additional information I'm trying to think of how to say this without making things more complicated. Let's say, for example, if it's related to RPE or sexual violence prevention work, because we have people in every state who do that, maybe I want to know more about evaluation or more about different types of interventions, who's doing what at the community level. It'd be nice to have a way to reach out to that handful of people that might say they have that expertise to say, who can particularly help me? But I like the idea of starting with this, so we at least know who to reach in our region, because we do have a lot of similar makeup around those of us that have high rural areas and access issues and stuff like that. So that's my comment.
So do you think it would be helpful to share both the topic areas of expertise as well as the skill competency areas?
I think so, just because at least even if a person isn't as familiar, isn't as competent, they might have some more resources or ideas or suggestions that I could go to if I'm looking for expertise at a certain time.
Okay, thank you.
Yeah.
Colleen, I'm wondering if there's even a way that we could, I don't know, it just depends on how we build this, but if there's a way to, you know, I have to admit I did a little online shopping this morning, Cyber Monday, but you know, you can go into a shopping site and query by kid, this size, this color, you know what I mean? If there's a way that we can build it where you can query like motor vehicle,
evaluation or
yeah, something like that. If there was a way you could click on that and then it would pull in and populate with the list of people who had marked those responses. I have no idea. It's something we could definitely consider. Okay.
Yeah, if anybody has done anything like that before, I'd be really interested in getting help.
Yeah, I have no idea. I have no idea if it would be worthwhile or not, but that's
a great idea.
Occurred to me.
Do others have thoughts on whether this would be helpful to your work or how you might use something like this?
I would think for particularly Wyoming, with being a new program, something like this might be really, really helpful for you all as you look at your needs assessment and figure out what directions you're going to go. Then you could call on people, within the region to run things past or get ideas about programming and intervention delivery, things like that.
Mm-hmm. Yeah.
Well, this is Carol. I think the other thing, there were very few people who indicated they didn't have expertise, but that may be a function of who responded.
Mm-hmm.
There may be people who, are trying to help newer people in their organization kind of get up to speed. So kind of building on Colleen's comment, that there may be ways to use this to help people identify, gee, I feel pretty competent, but I'm just hiring a new person who really needs some help learning about X, Y, or Z.
Yeah, that's a great point, and I think that as we develop new people, new practitioners to the field of injury and violence prevention, I'm hoping that this regional network and this list can serve as a resource for folks in that way too. Okay. Okay, well, we'll keep moving on. So I think this is my side, yeah. So another question we asked was an open-ended question that just asked whether for people to indicate which topics they'd like to learn more about to help us guide our schedule for our monthly learning opportunities. So the responses to the open-ended question really touched on various topic areas as well as competency skill areas. And I did a little thematic analysis of that, and the image on the left is a word bubble that I just used a web-based program to create. But just to run through some of the selected themes that came up. So in terms of competency skill areas, evaluation, data, policy, and communication all came up as part of the responses. And I know that we asked more specific questions around these 4 areas, partly because of what came out of the needs assessment that was conducted by the CDC about a year ago, last fall, around what the RNCO should be focusing on or specific to our regions. And then just a note around the communication piece, it was specifically around how to effectively communicate about the importance and impact of injury and violence prevention, and then really telling the story. So we will continue to focus on those 4 broad skill areas. Some of the other things that came up in terms of the open-ended question was some ideas and information that people would like to learn more around cross-sector collaborations for violence and injury prevention efforts. So that it was inclusive of strategies to involve businesses or the business community, considering the built environment as a facilitator for injury and violence prevention, and then also thinking about relationships or partnerships with hospitals or local public health agencies in relation to the Affordable Care Act. And then another collaboration piece, and I heard that this morning as folks talked about what they're excited about for next year, but is just better collaboration with health departments to do violence and injury prevention work as well. Funding came up as a theme for future learning opportunities, and this is including what new funding opportunities might be available for the states and for the members in our region or the organizations in our region, as well as how to advocate for operational funding support from organizations and institutions so that we are less reliant on grant or donor funding to do our work. And then this broad category around research, it was inclusive of considering, what new research opportunities are upcoming, and then also how we think about getting research into practice. And since one of the goals of the RNCO work is around that partnership between research and practice, and because we have membership from both sides, I'm hoping that we can do some focused learning opportunities around that particular topic area. Another area that came up a couple times was around social norms change, and so there wasn't any other specifics about that, but maybe as we meet as an advisory team, we can think to narrow down what we mean around social norms change and think about learning opportunities where we're sharing different different successes or ideas around how we change social norms for the work of injury and violence prevention. Sure, go ahead.
I was just thinking as you were talking about, back when, that's been probably 5 or 6 years ago, the RPE directors created this cross stage and included folks from our region. And one of the things that we were hoping could happen is that if a number of states were testing certain interventions, and I'm thinking more about like we were talking about social norms or community level change, that if there were, especially in states with rural areas where you don't have a lot of numbers, but if we could talk about sharing that information and the program measures, what we were learning, I would love to see something like that happen where a number of states, maybe 2 or 3 of them, if not all, that are sharing certain interventions and programs that want to learn from each other about that, because we just don't have the population to do that in some of our areas. So that's just a thought that came out of your suggestion.
Yeah, that's a great idea. Thank you. Sorry, I'm just making a note of that. So the next selected theme is around addressing shared risk and protective factors. This came up quite a few times in the open-ended question, and this is especially related for unintentional injury. So I know that a lot of the literature and research that has been conducted by the CDC has been really around shared risk and protective factor approach for violence prevention, and we also want to think about how we address shared risk and protective factors for unintentional injury topic areas. And so so this is maybe something that we can start to talk about and learn about, and share what we've learned across states for this work. Another selected, with a couple other selected themes around motivational interviewing, gender equity strategies, and then community mobilization. And so really best practices on how we engage communities in both our research and practice. And then this last one around systems thinking and how we apply systems thinking to our work is another area that we can talk about on our monthly learning opportunities. And then finally, I would just note that several people touched on various topic areas that they are interested in, and that ranged from sexual intimate partner violence prevention to unintentional injury to really specific topics like autonomous vehicles and chronic traumatic encephalopathy, CTE. And then a few people also pointed out wanting to learn more about overdose prevention, both prescription drug overdose, but also illicit and all poisoning. So thank you very much for taking the time to answer this question. We'll provide the more detailed results and themes when we report back in a formal PDF, and just to make sure that everybody can see not just the selected themes, but also more specific information. And Lisa, I think back to you here.
Yeah, so as Colleen was saying, those 4 kind of key areas that were identified in the needs assessment early on in the development of the region were data, data, evaluation, policy, and communication. So what we did was we tried to ask a couple of more specific questions that related to these, and I think what you were allowed to do was select all that apply. So what we were looking at is which of the following activities would you like to learn more about as it relates to, accessing data, interpreting it, using it, presenting it, kind of all of those things. And so you can kind of see the responses here. A couple of them rose to the top, and I think for the sake of presentation, I just shortened them down a little bit, but one of them, and I actually see a typo, sorry, was just really getting a handle on being able to describe what are some of the key sources of data that are available to us, be it national, state, or community level data. And so I think that's something I really like to see on our Plains to Peaks website, is that there's going to maybe potentially be a spot for some of those data sources to live so people can easily access them, and we can kind of come together and talk about, what are the resources available, but then also talk about what are the strengths and weaknesses of using some of that data. So that's a potential maybe peer learning opportunity in the future, is talking through what are the data sources that are available. Another one that I thought you can see towards the top of this chart was really looking at being able to describe qualitative and quantitative data, how they can be used, and conducting an assets and a needs assessment in a community of interest. So looking at qualitative and quantitative data, the differences, but then also how we can use it. And then just really being able to take the data that we have available to us and present it in a more clear and understandable manner for different audiences. I think being in the research realm, we tend to fall into this trap of we have a lot of data available, but we might not always present it in a very usable and understandable way to the general population or to an audience that we're working with. So those were just some of the things, but you can see data, I think, continues to rise to the top in a lot of different areas of the ways that we want to understand it better and how we want to use it. Any questions about data? And again, this will be provided in a more complete report, so you'll be able to see each of the areas a little bit more specifically. So evaluation, again, was another one, and we asked again, which of the following activities would you like to learn more about when it comes to evaluating violence and injury prevention programs? And again, it looks to me like we just are looking to understand effective means of communicating evaluation results, as well as really knowing the role of evaluation and identifying some of those key areas or components of the intervention that are effective. We also are looking at, I'm trying to look to see another one, just implementing an evaluation plan. And it's funny because it says implement an evaluation plan for an evaluation. So really planning, how do we incorporate evaluation into all of the work that we're doing? And I think evaluation is so key, and a lot of us are struggling with it and knowing how to do it and how to develop it. And then a couple of the other ones, again, that just rose to the top were maybe identifying potential barriers to specific types of evaluation and then how to approach that. So what type of evaluation should you do, and there are certain barriers. And then how can we just integrate this into our intervention planning? Policy is something we've actually done a little bit of work on as far as, number one, at the face-to-face meeting at the Safe States Conference, we talked about policy briefs, but I think we also did a policy learning opportunity maybe late summer that I think was particularly helpful to folks, but we also are moving into a new year, and that always means, you know, we want to continue our policy work. And so looking at really, and I think somebody in Colorado mentioned this, you know, identifying information on the costs of injury was one of the big things that came up of injury and violence prevention, and being able to describe it in the application to policymaking. So that's something I think we should take a hard look at and would be useful. And then just identifying gaps in policies and regulations and enforcement that, you know, if we could address them, could actually reduce violence and injury in the community. And then there are a couple of other ones. It's really just kind of describing the role identifying their potential partners and opponents in influencing policy, laws, enforcement, regulations. So policy is another area we want to continue to focus on. And then lastly, communication continues to be one of the areas that we want to, look at as it relates. And so one of the things was just looking at how to prepare a professional report or a publication and being part of that. So whether it's a regional type of publication that we wanted to prepare, might be a by-state publication, or maybe it's just a state-level injury report. I know I can speak from experience here in Iowa. That's something we've tried to do about every 5 years. It's sometimes easy, sometimes difficult, but it is of benefit, I feel like, to our state. And, you know, Benny, you can certainly chime in on that, but I think it's been effective, number one, to communicate to, you know, leadership of our state health department, but also to other stakeholders as well as policymakers about the violence and injury issue in our state. And then just talking about the different types of written communication and documentation that's out there and available. And I really liked only one person said this, but I think it would be valuable as social media training, is just figuring out how to communicate our messages via social media, since there are lots of, you know, we all use it, I guess. So that, I mean, this is just a really, really quick overview of the responses that we received in the survey. We'll publish that more complete report, but I'm curious to know whether we have any discussion or areas that we want to continue to focus on, or talk through which topics for the learning opportunities would be helpful at this point, because I know Colleen reviewed a lot of those as well. So any thoughts or discussion about any of that? I don't think any of it was particularly surprising to me when I looked through what are the areas that people want to know more about or have more learning opportunities, focused on.
This is Carol. I mean, one thought is to think about, some of the opportunities that are already out there that we don't need to replicate. For example, I've forgotten what they call it now, the South by Southwest, whatever it is, regional network has been doing a series of presentations around the core competencies. I was involved in the one on data. And, we might want to think about ways to make those available through the website, and not duplicate those, but rather focus on other topics that, that haven't been produced yet. And, I'm not sure what those should be, but there's certainly a lot of topics to go around, but it seems kind of wasteful to recreate good ones.
Yeah, I think that's a great idea, and I can reach out to Jennifer Woody to see where those recorded opportunities are living and share those with the rest of the team, and maybe something then we could use or focus on in our learning opportunities is maybe kind of doing some follow-up discussion after people have already viewed those, and talk about how we're implementing or applying what we've learned in our states. Any other thoughts that people have around topics for learning opportunities that would be helpful to your work? And if anything, we have a lot to start with, which is great. Mandy also wrote a note that the core competency webinars on the Safe States website would be probably good to share as well. So thanks, Mandy, for that idea. So I'm gonna keep moving us along since we're getting close to the end of our time here. So.
Well, this was just an opportunity for us to get a little bit more information from the state injury directors, and 5 of the 10 completed the survey. And this was just to get a better sense of what the funding is in each of the states, or what are the different sources that are used for violence and injury prevention. And so this is, you can kind of see what are the variety. Now, in the other category were TBI, block grant funding, Consumer Product Safety Commission funding, as well as some older adult falls funding that some of the states have. So you can just see, again, the variety. And we didn't have all state directors fill this out, but just, I know funding had come up in the open-ended question as something we want to kind of consider and talk about, and maybe think of some more unique areas or different to diversify our funding portfolios.
So that is the brief overview of the survey results, and as we mentioned, we had a pretty quick turnaround time to fill out the survey, so thank you to those of you who had, and I think we did have good representation for all the states in our region. But we are going to plan to leave the inventory survey open and collect rolling responses, and I think that this will be helpful just as any new members join the network, and then or if you haven't had the chance to take it already or share with your colleagues, it is open, and I can resend this link in an email as well as a reminder to take it. But in the meantime, Lisa and Tracy from the Iowa Injury Research Control Center will be coming up with a more full report with all the survey results, and we'll figure out, I'll talk with them around figuring out kind of like a cutoff time to do that, and then we can always add to the report or check in on a regular basis to see if anybody new has seen the inventory survey. And then, as we talked about earlier, we are planning on creating a public-facing member contact list and posting this to our website using the information from the survey. We also asked questions around contact information and really understanding where people are coming from and what their roles are. And I think this would be really helpful to map out along with the skill competency areas and topic areas so that we can access each other as resources in our regional network.
Colleen, if we can't remember whether we filled out the survey or not, will Qualtrics know?
Yeah, so because we collected contact information, we can, and actually that's something Lisa and I talked about too, is that because we know who has and hasn't taken the survey, we can do, you know what we'll do is individualized invite to the survey if you haven't already. So just wrapping up in our final 5 minutes here, and we are right on time, which I'm really happy about. So our next learning opportunity is Wednesday, January 31st, 2018. As an advisory team, we decided to skip the December because that end of December is that holiday week, and I know that a lot of people take time off to spend some time with their families. So hopefully you got the invitation for that learning opportunity. I sent it out just before Thanksgiving last week, but it'll be Wednesday, January 31st, 1 to 2 p.m. Mountain Time and 2 to 3 p.m. Central Time. The focus of this topic area is going to be around policy, and the reason that the advisory team selected that as the focus area is because we have a couple Safe States policy fellows in our network, and would like to invite them if they're available to share about what they're working on and their learning. And then we know that this is also a time in January when legislative sessions at the state level starts up for a lot of our states in our region, and so we'll do a little bit of discussion around what is upcoming for legislative sessions and the roles that that we all play in policy work and educating our policymakers on injury and violence prevention. And so more to come on that. I'm also going to send out a doodle poll for the advisory team to meet in December, just so that we can check in and continue planning out our monthly learning opportunities. And then we did want to ask just a quick poll, and I think I need to, Marissa, do I need to not share stop my share for this to work? Or?
I think you need to give permission back to me to share it.
Okay. Are you is that working?
It's not. So if you give me a second, I can try and configure something really quick.
Yeah, we're playing with new functionality in Zoom.
It's weird because on the back end, I could like log in as Sarah, but it doesn't seem to have connected. But I'll throw it in really quick.
Well, while she's doing that, I know I ran out of juice in my computer, and probably in mid-sentence when I was talking before. But were you able to hear my suggestion that we work with some of the webinars that have already been produced?
Oh yeah.
Yeah. Okay.
Yeah. We heard that for South by Southwest, and then Mandy had also mentioned that Safe States Alliance has a lot of those webinars.
Yeah. Okay.
And I'm going to launch the poll now, Colleen.
Okay, so for our February learning opportunity, we wanted to ask we wanted to do a data focus in February, and these were the top 4 highly ranked results from our survey. But if you could take the time to vote on what you would like to learn more about per February, and then we'll identify a time and who will help with some of that. I can't even read it; it's so small on my screen. So we'll give folks 1 more minute to vote if you can. Okay, we have 60% of you who participated, so I'm going to end the poll now. And can you see the, oh wait, share results. Okay, can you see the results of that? So it looks like we're going to focus on demonstrating the ability to present data in a clear and understandable manner for different audiences. So thank you for helping us figure that out. So that is it for today's learning opportunity. If anybody has final thoughts or things to share in the last minute, the floor is open. But other than that, thank you so much for participating, and we look forward to continuing this regional network into 2018. Okay, bye everyone.
Thank you.
Bye. Bye.